D2 pattern for the lower extremities. Begin with your lower extremity in the extreme of D2 extension, which is hip extension, adduction, external rotation, knee flexion, ankle plantar flexion, and inversion. You should stand with your left hip near their right grotor trochanter and facing their feet. Your right foot in front of the left. Place your right hand on the dorsal lateral aspect of their right foot and your left hand on the anterior lateral aspect of their proximal right knee. Give a quick stretch into plantar flexion and external rotation to facilitate dorsiflexion and internal rotation. Tell your patient to pull their foot up and out as you provide resistance to the flexion pattern, and you lunge backwards and take most of the weight on your left foot. Now you are in the extreme D2 flexion position, which is hip flexion, abduction, internal rotation, knee flexion, ankle dorsiflexion, and eversion. Move your right hand so that it is on the ball of the foot and your fingers on the medial aspect of the foot. Wrap your left hand under the leg so that you can provide resistance to the posterior medial aspect of the leg just proximal to the knee. Give a quick stretch into internal rotation and flexion so that you can facilitate external rotation and extension. Tell your patient to push down and in as you provide resistance to the D2 extension pattern and lunge forward on your right foot.
Pull up and out. Push down and in. Pull up and out. Pull down and in. Push up and out. Pull down and in.
Now we're going to show an alternate hand placement on the foot for the extension portion of D2.
This is the first one. You can also come around here. As long as you're on the medial side, do your quick stretch, push down and in. Up and out. Push down and in.